Pet health myth debunked. There are so many widely accepted misconceptions that it can be difficult to tell what is true and what is not. You might even have evidence that these things are true, or you might stumble upon a site that supports them. Is it true that dogs have a cleaner mouth than humans? Is it true that cats despise water? Is raw meat the only good dog food? In this video, we will learn the reality of pet myths. That is why we have compiled a list of some of the 7 most popular pet health myths to avoid and explain the truth behind the myth. Myth number 1. Dogs consume grass in order to puke. This is just partly correct. The majority of dogs that eat grass do not vomit afterwards. Indeed, many behaviorists believe that grass munching is a natural behavior that dogs just enjoy. Pets will occasionally eat grass and then vomit. So, did the animal eat the grass to alleviate indigestion, or did the grass make them sick? It's a chicken and egg problem. Grass can be treated with fertilizers and pesticides that are toxic to dogs. What we do know is that only around a quarter of dogs vomit after eating grass, and only about 10% show signs of disease before eating grass. As a result, in the majority of cases, the two behaviors are unrelated. Dogs consume grass just for the sake of eating. Myth number 2. Cat health issues are less expensive than dog health issues. Both dogs and cats have chronic health issues that necessitate tests and medication to manage. Many people believe that treating a sick cat is less expensive than treating a sick dog. While it is true that many cats are smaller than most dogs, and hence medications, which are generally dosed according to body weight, are less expensive, basic health care is just as expensive. An X-ray on a cat, a dog, or a human, for example, will cost the same. This is also true for routine blood tests. It is also the same cost to place an IV catheter in a cat as it is in a dog, albeit a large dog may require more fluids, which would cost more. Up to 35% of pet owners admit to underestimating the expense of their pets, so you're not alone if you thought your cat would be a cheaper alternative than a dog. In reality, cat care is likely to be just slightly less expensive than dog care in the long run, if at all. Myth number 3. Out of spite, pets destroy and pee on objects. Myth debunked. Animals do not experience feelings like spite, nor do they generally feel guilty when we yell at them, despite their appearance. Animals usually destroy things because they are bored and want to entertain themselves while no one else is around. These pets frequently require additional exercise, mental stimulation, and instruction. An animal urinating in the house is often sending a very clear message. There is either a health issue or something wrong with the litter box or bathroom setup. Pets that pee in the home or outside the litter box should be seen by a veterinarian. Myth number 4. It is acceptable to feed them table scraps. The digestive tract of pets is not built to metabolize their human family's high-fat or high-carb diet. As a result, it is not uncommon for pets to experience major stomach issues after consuming human food. The most concerning is pancreatitis, which can be fatal. Long-term issues include weight gain and/or malnutrition. If you truly want to share with your pet, stick to vegetables that haven't been seasoned or coated with butter. Myth number 5. It is acceptable for pets to lick their wounds. This myth is incorrect on multiple counts. When pets lick their wounds, they put all of the bacteria in their mouth right into the wound, causing infection. Furthermore, the rough barbs on the tongue inflame and irritate the tissue surrounding the wound, exacerbating the agony. And, of course, because it hurts, the animal licks even more, creating a vicious cycle. Some pets may take a small cut and grow it several inches longer in a matter of hours. As unpleasant as it may be for all parties concerned, pets with wounds should wear an e-collar to prevent them from licking or biting the wound until it has completely healed. Myth number 6. They don't have fleas because I don't see any on my pet. This is a legend. 95% of the fleas in your house at any given moment do not live on your pet, believe it or not. The vast majority of fleas in an area aren't adult fleas, which are what you're likely to see on your pet. These troublesome little animals, however, spend the majority of their time in the house as babies, eggs, larvae, and pupae. You will never see these stages of the life cycle. A single adult female flea can lay up to 2,000 eggs in her brief lifetime, making detecting a single flea difficult. To make matters worse, many adult fleas are gone when your pet cleans, making it even less likely that you will see them. Even if you don't see any fleas, they could be present. Examine the fur for flea filth, which appears as tiny dark specks, as well as excessive scratching and ulcers caused by your pet scratching when fleas bite. The best method to assure that your pet does not have fleas is to maintain them on a prescription flea treatment year-round. Myth number 7. A warm nose indicates that your pet is sick. False again. A warm nose simply indicates that your pet has a warm nose. More than a health indicator, nose temperature is a reflection of the surrounding environment, such as room temperature and humidity. If your pet has a warm nose and otherwise appears to be performing normally, there is probably nothing to be concerned about. Thanks for watching this video, and I hope you found the information shared helpful. Please kindly support us with your comments, likes, and subscriptions. See you in our next video.